In this video, I'll teach you how to treat psoriasis like a dermatologist. We'll go through my 5-step algorithm that delivers consistent results while minimizing headaches and side effects for patients. There's also a pro tip at the end that's essential to consider before you even think about diving into treatment options. But before we get into that, make sure you hit that like and subscribe button below. I'm Adam Aldahan, board-certified dermatologist, and I've spent a bajillion hours researching and simplifying complicated topics, so you don't have to. This is my tried and true approach to psoriasis. The treatments themselves can be complicated with random nuances and things to watch out for, but once you understand them all, the approach is actually quite simple. Really, the hardest part is not accidentally forgetting one of the treatment options along the way. This is my 5-step approach to success. Step 1. Topicals. This is usually steroids, and strong ones too. Why? Because psoriasis is an inflammatory condition, and steroids are anti-inflammatory. They just work. And you don't have to worry about systemic absorption if you're just treating small areas on the skin. There are generally no internal side effects to topical steroids. Now, topical steroids can have side effects on the skin itself, especially skin thinning or atrophy. But if you have psoriasis and you're dealing with thick psoriatic plaques, the last thing you're worried about is thinning of the skin. But for all you steroid phobics out there are also non-steroidal options that we can use topically, such as calcipotriene or tacrolimus. There's even new fancier ones like tapinarof, although generally the newer the medication is, the more expensive it's going to be. Step 2. Local steroid injections for stubborn plaques. Injecting the steroid under the skin definitely works better than applying it to the surface. We don't have to worry about creams and ointments penetrating into the skin. We just inject it right where it needs to go, past the skin's barrier. These are basically like the strongest topical steroid we can use, well, on steroids. Step 3. Lights. I'm not talking about sunlight, and I'm definitely not talking about tanning beds. Never tanning beds. No, we use narrowband UVB, which specifically targets the inflammation that drives psoriasis. Lights are actually a really effective option with no internal side effects. The only problem is they take forever to kick in, and you have to come into clinic 2 to 3 times a week for months on end, which doesn't really jibe with most people's 21st century schedule. And yes, I know jibe is so 1940. Do people even use that word anymore? Step 4. Cheap pills. An affordable pill for psoriasis is methotrexate. I personally love using this medication in the right patient because it's generally well tolerated and it's effective. It does require lab monitoring, and yes, it has a huge list of side effects, although most of these side effects are seen at higher doses, much higher than we generally use to treat psoriasis. You also can't drink on it, so there's that. Other pills include acitretin. Can't drink on that either. Who comes up with these pills? Then there's apremilast, which is a really great pill, except for A, it's expensive in the US, and B, it causes intolerable diarrhea in something like 1 out of 3 patients who take it. Although if I had psoriasis, I'd probably roll the dice. Step 5. Injectables. This is a whole topic on its own. The injectables we use for psoriasis are what we consider immunosuppressive, meaning they affect some part of our immune system in order to reduce the inflammatory pathway that drives psoriasis. But a side effect of weakening our immune system is that we're more likely to develop infections, and some cancers as well. So we don't prescribe these lightly. The big infection that we worry about is tuberculosis. Although in the US it's not super common, but it's out there. And just because a medicine affects our immune system doesn't mean it's the worst thing in the world. And the different medicines that we use actually affect our immune system differently, some more than others. Basically, our immune system is like a tree with branches. The bigger the branch, the more of our immune system it affects. The new medicines that are coming out are really targeting very small branches of our immune system without causing the other unwanted side effects by affecting other parts of our immune system. This is a good thing. Before I dive into specific injectables, I want to make a quick note about prednisone or other systemic steroids. Prednisone is basically like hitting our immune system at the trunk. It affects all aspects of our immune system. No bueno. Prednisone causes a lot of issues and secondary side effects and should seriously be avoided in psoriasis. Yeah, it does treat psoriasis, but guess what? The second you come off of prednisone, your psoriasis tends to bounce back or rebound. And often this rebound psoriasis is worse than it was before you started the prednisone. Okay, back to injections. The injections we use are in a class of medications called biologics. They're called biologics because in development, they use a specific cell of some organism to create these medicines. Using biologic components to develop medicines allows us to specifically target certain parts of our body, thereby reducing side effects. I generally like to avoid brand names when talking about medications, But when it comes to biologics, brand names are just so much easier to say, and people are more familiar with them. I don't tend to get patients coming into the clinic asking me about risankizumab, but I do get patients coming in asking about Skyrizi. Plus, there really aren't any generic alternatives out there, meaning there's no knockoff version of risankizumab. There's just Skyrizi. P.S. This video is not sponsored by any of the brands I'm about to talk about. This is a general overview of biologics and where they affect our immune system. This is not meant to be completely comprehensive or exhaustive of everything out there. Just a guide. Okay, here's our immune system tree. In my mind, the original biologics target tumor necrosis factor alpha, also known as TNF-alpha, which is a fairly large branch of our tree that has lots of downstream or downbranch effects. Meds that block TNF-alpha include Humira, Enbrel, Cimzia, and Remicade. Next, we have smaller branches, which are called interleukins, or ILs. IL-12 and 23 blockers include Stelara. But why block both 12 and 23 if you can get away with just blocking 23? That's where Skyrizi, Tremfya, and Ilumya come in. These are our IL-23 blockers. Our IL-17 blockers include Taltz, Cosentyx, and Siliq. IL-17 is a smaller branch than IL-12 or 23, but these are absolute no-goes if you have inflammatory bowel disease, including Crohn's or ulcerative colitis. There are always new medications being developed, but the ones we have now are seriously effective at clearing psoriasis with minimal side effects. The good ones just tend to be expensive, but hey, someone's got to pay the pharmaceutical guys for developing these. And personally, I'm okay with fancy medicines being expensive, because if there was no financial upside for these pharmaceutical companies, they just wouldn't make complex medicines. And then I think we'd all be much worse off. It wasn't long ago that psoriasis was one of our most difficult conditions to treat. People either suffered from having psoriasis all over their body, or they suffered from terrible side effects to old-fashioned medications. Those days are long gone, and I think there's some value to that. And finally, our pro tip. I seriously can't believe how many doctors miss this. If you have psoriasis, and it started after, let's say, 30 years old, and you're taking medications or supplements, one of your medications could be unmasking or bringing out your psoriasis. Before you go down a long, difficult treatment journey, consider removing the causal medication, and hey, your psoriasis might just resolve on its own. In the medical field, we are so good at adding new medications to things, but we're not so good at taking medications away. Sometimes, less is more. Hope you enjoyed your coffee break.